Hello, dear students. My name is Volodymyr Khomyak. I'm Associate Professor of Department of Surgery number 1, Danylo Halytsky, Lviv National Medical University. As I mentioned in the previous video, this year graduate examinations in our university will be held online. In this video, I will explain you about station clinical scenario or clinical case for objective structured clinical examination. So we proceed to instructions of your actions during exam. When the teacher will connect you to Zoom video chat conference M04, you'll have to introduce yourself and show your passport on the page with your photo to the camera to identify your person. After this, you'll hear a ring bell and the teacher will turn you on presentation with your task. You'll have 10 minutes for this task. You'll have to answer the questions on every slide. So now we proceed to slides. On the first slide, the task is that male, 26-year-old, having pain in the right lower quadrant. The question is, what are the rules of collecting the patient's complaints, history of present illness, and past medical history? So you will have to answer this question for exactly your task. So for my task, I would like to say that if patient is having pain in abdominal cavity, I would like to know more about this pain. For example, I would like to know the severity of the pain, the character of the pain. I would like to know if the pain is irradiating somewhere. If the patient is having problems in abdominal cavity, I would like to ask him about the other symptoms which are associated with abdominal pathology: nausea, vomiting, loss of appetite, presence of the passing gases, stool, character of the stool, and many other questions which I would like to ask the patient concerning abdominal pathology. For history of present illness, I would like to find out in chronological order how and where the pain starts and how the pain was changing. I would like to know when additional symptoms appears and have they changed or not. In past medical history, I would like to collect the data which would be very important for me, finding out if the patient is having some concomitant diseases, which would be limitation for example, for surgical intervention or limitation for any other medical treatment and so on. And I would like to treat also the main disease and also treat the concomitant disease, because we are treating the patient, not the disease itself. So you would ask the patient, you would ask the teacher to show you the next slide. On the next slide, we see the patient is complaining for acute pain in the right lower quadrant, loss of appetite, nausea, one-time vomiting, fever 38 degrees. In the history of present illness, pain starts 5 hours ago in the epigastric region and 2 hours ago migrated to the right lower quadrant. Patient never experienced such pain in the past. Past medical history, patients have an allergy to ampicillin and no other serious comorbidities. So I must analyze complaints, history of present illness, and past medical history of this patient. So I must say that in these complaints, we see that patient is having already know the pain in the right lower quadrant. Patient is having poor appetite. He had one-time vomiting, which is very typical for classical case of acute appendicitis, for example. And the fever is telling us that patient is having inflammation in abdominal cavity. So it also moves us to the diagnosis acute appendicitis. In the history of present illness, we see that the pain starts in the epigastric region and then migrated to the right lower quadrant, and we know this as a symptom of Kocher. Yeah, this Kocher symptom, which is typical also for acute appendicitis. In the past medical history, we see very important information that patient is having allergy to ampicillin. So it means that we wouldn't prescribe the patients penicillins at all. On the next slide, we see the physical findings and objective findings. The general condition of the patient is of moderate severity. Vital signs: blood pressure is 120 to 80 millimeters mercury, heart rate is 102 beats per minute, body temperature 38.3 degrees at the moment of admission to the hospital, height 177 centimeters, weight 68 kilograms, body mass index 21.7. A normal shape of abdomen, palpation, tenderness, and muscle guarding in the right lower quadrant. So what is the most probable diagnosis? As I mentioned previously, most probably the patient is having acute appendicitis. Why do I think so? Because patient is having pain in the right lower quadrant. This pain starts in the epigastric region, migrated to the right lower quadrant. Patient had one-time vomiting. Patient is having fever. On physical findings, we see that he is having tenderness and muscle guarding in the right lower quadrant. He is having tachycardia, which is telling us about the inflammation. How to check Bloomberg sign, Rovsing sign, Psoas sign. Answering such type of question, you will have to quickly reproduce how you would be performing and explain the teacher how you would be performing exactly this, checking this symptom. For example, Bloomberg sign. I'm pressing deep in the right lower quadrant. Very important on your explanation would be to use the data of exactly your patient or reproduce how exactly you would be performing exactly in this patient which you have in this clinical case. So I'm pressing deeply in the right lower quadrant. I'm waiting for several seconds until the patient would feel the pain from my pressing would be decreased, and then rapidly remove the hand. When I rapidly remove the hand, patient would say that he is feeling severe pain in this right lower quadrant from the shaking moving of anterior abdominal wall. The same way I would explain two other symptoms. Which laboratory examinations you would perform in this case? So while answering this question, you can answer in general that, for example, for practically any case which requires surgical intervention, we will have to perform CBC, we will have to perform urinary test, we'll have to perform biochemical test and coagulogram. Of course, teacher can ask you what exactly you would be looking for in CBC, what exactly you will be looking for in biochemical test, which exactly parameters of biochemical test you would like to check in this or that case. And of course, concerning your diagnosis, you will have to say what you would be looking for or which parameters you would be checking. On the next slide, we see the results of laboratory investigation and the question, what does prove the diagnosis in this laboratory test? As I already mentioned, my patient is having acute appendicitis. It means this is acute bacterial inflammation in the body of the patient. So we see that we have elevated level of white blood cells and we see the elevated level of C-reactive protein. So this two changed parameters are telling us that patient is having severe inflammation in abdominal cavity. Which instrumental examination you would perform in this patient? I would like to mention that in cases of acute appendicitis, routinely we perform only ultrasonography. But in cases when it is difficult to make diagnosis, most probably not in this patient, we would like also to perform CT scan. And CT scan is a gold standard for diagnosing acute appendicitis in the most complicated cases. So on this picture, I see ultrasonogram and I see the longitudinal section in which I see the content in the lumen of the appendix, thickened wall of the appendix, and fluid around the appendix, yes, which is telling that we are having inflammation of the appendix. On these two pictures, I see the typical sign of cross-section of the appendix, which is called the target sign. We see the target sign, we see the lumen, we see the thickened wall, and we see the fluid around the appendix. And as we can see from this picture, without compression. With compression, the shape of the appendix is not changed. So it means we have inflammation, we have high pressure inside the lumen, we have a rigid wall of the appendix, and these ultrasonographic waves do not compress the appendix, and it means we are having acute inflammation. So this ultrasonography proves that we are having acute appendicitis. What is differential diagnosis? For differential diagnosis, I would like to, for this case, I would like to differentiate with a right-sided renal colic, with inflammation of macula diverticulum, with peptic ulcer perforation. Maybe you would have to explain somehow why you are differentiated with this as a disease. For this question, you can prepare the answer before the exam, because on the next slide you would see, you already know that we are having on the 10 clinical cases, and on the next slide you would see exact diagnosis of these 10 clinical cases. So prepare the list of differential diagnosis diseases for exactly this or that diagnosis which you would have on the state exam. What is medical and surgical tactics? Well, speaking about medical tactics, I must say that patient came to the hospital with the pain in the right lower quadrant. So I would like to treat this pain. I would give the patient analgesics. Next, patient is having bacterial inflammation, which is causing destruction of the appendix. I would like to treat this inflammation and I would give the patient antibiotic. Of course, I would choose between antibiotics, not from the penicillin group. And surgical treatment tactics, we are having two options. We are having the open surgery, typical conventional operation, and we are having laparoscopic operation, which can be done. Both of methods are comparably good. So I would choose from the opportunities of my hospital: open surgery or laparoscopic surgery, laparoscopic appendectomy. Of course, you should mention which exactly operation you would perform. Maybe sometimes you would need some more details in treatment in speaking more precisely about the exact operation. So this would be the end of your answer. So if your answer lasts less than 10 minutes, you'll have to stay on this station until you'll hear a second ring. At the end of the time, you'll hear a second ring, and the teacher will remove you from Zoom video conference station M04. Please, students, I'm asking again, don't leave the video conference by your own. Only teacher is administering this video conference. Okay, on the next slide, you can see 10 diagnoses and 10 tasks which you would have, and you would be able to prepare to learn how to, and to explain what does it mean and how to check this or that syndrome, or perform this or that examination. Plus, if you have diagnoses, you would be able to make a list before maybe the exam, make a list of differential diagnosis, and this would be, and learn it, it would be much more easier for you to pass the exam. So if you have any questions, do not hesitate to ask them in comments, and I wish you a good luck.